county and others have used to fund innovative programs that promote holistic care like temporary housing and other services that aren't normally covered by Medicaid, but we know contribute to people's overall health. That waiver is expiring before the end of this calendar year. It is unknown whether the federal government will renew it. What we do know is that the governor of California has proposed ending state coverage specifically for mobile crisis services, which is maddening because they are well utilized and they are showing positive impact in our county and in counties across the state. Also, at the state level, the shift from Mental Health Services Act, which has been in place for decades, to the new Behavioral Health Services Act, which was approved by voters in through Prop 1 last, I don't know, century, I can't remember, 2024. This shift fundamentally redefines what Sacramento expects from counties. First, the amount of funding that the state is now collecting instead of dispersing to counties has doubled. These were local dollars that were previously used to invest in our workforce and in prevention and early intervention programs, again, like the NISIS. Without them, we will undoubtedly see higher demand for ER visits, crisis stabilization, intensive treatment, and long-term care. This is expensive and this is brutal. In the category of children, families, and youth, we are facing a moment which brings both some reassuring stability and some significant fiscal and policy changes. On the positive side, our core departmental operations remain fiscally intact. Roughly 90% of social service agencies' work is mandated by the federal government, and that revenue currently looks fairly stable. In our aging and adult services, while the congregate meal program at senior centers won't change, there is projected to be about a 30% decrease in home-delivered meals compared with the current fiscal year. I see some of you nodding, so you already know this. This is a concerning loss for our most vulnerable older adults who need this service and need to eat every day. Related to older adults, the in-home supportive providers, of course, remain underpaid despite the critical care that they deliver. And because they're not county employees, we can't limit or set the numbers, even as demand grows. IHSS is designed as a shared federal, state, county responsibility. Yet, and I will sound like a broken record soon, the county's share continues to rise sharply. And compounding this, the governor's proposed budget introduces additional risks to county budgets around IHSS. He is recommending eliminating a backup provider system in the coming fiscal year that would remove a critical safety net for recipients in the coming fiscal year, that would remove a critical safety net for recipients when their primary provider is unavailable. They're also proposing in the following year to shift responsibility for growth in the average hours from the state to counties. This, of course, would further in health benefits and rate supplements. We cannot carry an underfunded statewide system alone. State and federal partners must do more, and I encourage everyone to join me in these advocacy efforts. More on advocacy in a little bit. Within the Department of Children and Family Services, we're expecting moderate impacts to prevention and schooling services, though the mandated child welfare functions, of course, will remain mostly intact, while the board and administration continue to seek opportunities to strengthen these mandated functions. I should make mention of a topic that also is weighing heavily on my heart, and I imagine on many of yours if you are keeping up with the news. The recent deaths of 2 young children who were being served by our county have made it clear that the county's child welfare system is not functioning as it should, and there is so much work that we need to do. Just last week, the board approved a number of actions that aim to strengthen this system and bolster child safety along the continuum of care by enhancing compliance, transparency, and accountability within the department. We're taking actions now to ensure that the children in our system and receiving services are safe and have the best care possible. As a result of our board's recent actions, we can also expect a revised budget proposal for SSA, for social services, to come to the board in June that reinforce mandated services for children and youth, talk about public safety and justice. Real and broad public safety requires a balanced approach, both inside and outside what many people think of as the traditional public safety services. I've advocated for years for a comprehensive violence prevention framework and protection of funding programs that alleviate conditions that lead to harm before they start. And they are consistently the most cost-effective tools we have. But those are not the mandated programs. The mandated programs are the deep end, terrible things have already happened programs. In the meantime, in our current budget, each of the traditional public safety departments will see some reductions, although only about half of what they would have seen had Measure A not passed. So while Measure A dollars are not directly going to support the public safety and justice system departments, because of Measure A, we can preserve more of our general funds for other services that we provide. And our public safety departments are the largest or second largest general funded programs in the county. The final committee that I'll talk about is Housing, Land Use, Environment, and Transportation, which somehow is referred to as HULIT. The acronym doesn't work. But I will share a little bit of good news here. A bright spot in the work that we are doing in our Office of Supportive Housing is the county's homelessness prevention services. Our homelessness prevention and supportive housing system work and have been validated by external partners to work and can work at scale if we invest accordingly and in an ongoing way. In the past year, across Santa Clara County, our capacity has grown in nearly every major housing project type. Emergency shelters, we expanded emergency shelters by 39%, now offering more than 3,100 beds. Our rapid rehousing program grew by 11%, with the ability now to stabilize more than 1,600 households every year. And with 886 new permanent supportive housing and rapid response housing units approved or under construction just this year, we are continuing to build the long-term foundation that our county, that our community needs. Here's the reality. We are doing more than ever. We are serving more people than ever. The system is stretched to its limits, and it is very hard to visibly see improvements on our streets. Which brings me to another point of advocacy. If we want to keep people housed, if we want to prevent homelessness before it starts, if we want to reduce the number of people living outside and not just manage them, that's again something we cannot do alone. This is a moment where we need the state to step in. Yet, for the 8th year in a row, yes, not coincidentally, as long as Newsom has been the governor, the state budget has not provided sustained ongoing to reduce homelessness. The governor talked about the billions of dollars he has invested in homelessness, but just take a look at the chart because it's important to note that slightly less than a quarter of that funding actually has come to counties, and it comes in 1 year at a time allocations with no promises regarding the next year. And this system or practice of 1 year at a time allocation and continuously shifting the goalposts does not allow us to make long-term investments. This year's homeless housing assistance and prevention allocation was $500 million, the amount truly needed to sustain adequate services should be at least double that. So as we transition in just a minute into a deeper conversation about what partnership looks like with the governor's office, I want us to hold on to one truth. Our system in Santa Clara County works. It works when it's resourced, it works when it's supported. And with a true partner committed and are mandated to carry out policies enacted at that level, it is essential that we partner with our state representatives and the governor's office to ensure that we can actually implement and operationalize the work that we are required to do. And that's probably the most fundamental difference between cities and counties, is this interdependence we have with the state. Unfortunately, the governor's budget did not recognize any partnership with counties, and we are now looking to and working with our state legislators who are speaking up on our behalf. This year, all 58 counties, including our own, have called on the governor to take critical actions to prevent catastrophic contraction of healthcare services in every corner of the state. We've had 7 asks altogether, some by all of the counties, some just by Santa Clara County. The first one is that we stabilize California's public hospital systems. H.R. 1 creates a $1 billion annual deficit just here in Santa Clara County. Public hospitals make up just 6% of hospitals statewide, but they handle more than 50% of the trauma cases and more than 50% of residency programs. These are the hospitals that keep our communities alive in moments of crisis. Our second ask has been to invest in the workforce required to implement federal changes. Eligibility workloads. Eligibility workers are, sorry, I have hair in my face. Eligibility workers are the county employees who help people sign up for and enroll in services for which they are eligible. Hence, they are called eligibility workers. Because there are so many more complicated requirements to maintain Medicaid right now, and you have to declare your eligibility twice a year rather than once a year, this is going to be an immense increase in workload for our eligibility workers. But for every person we keep on their Medicaid, that is a huge savings compared to the investments that we need to be making to expand that eligibility workforce. That is, to me, a clear return on investment. There is some money in the proposed budget for that. I would like to see more, but very, very appreciative of what is there. Our third ask is that the state provide ongoing funds to address the surge in uninsured residents, because despite our best efforts, despite the additional work that eligibility workers will do, millions of Californians across the state are expected to lose coverage due to those federal changes from H.R. 1 and expiring Affordable Care Act subsidies. Without support, those folks will turn to county systems that are already stretched to the breaking point. I'll say a little bit more about that at the end. Our fourth ask is that the governor not shift the Medi-Cal state-only model from managed care to fee-for-service. I don't know if you know what any of those words mean, and I can tell you a year ago, I did not know what any of those words mean. But right now, we have a population, Medi-Cal only, of undocumented and people with uncertain immigration status who have been covered by a Medi-Cal expansion for the last number of years. It was a great program introduced by Governor Newsom, and he deserves all of the kudos for that. However, it has been unexpectedly, to him anyway, popular, well-received, and over-enrolled. So now they are pulling back. They are pulling back on eligibility requirements. They have already frozen enrollment. They are increasing copays. They've taken away dental insurance. But the biggest thing that the governor has proposed is this change from managed care. If any of you are on Kaiser, you know what that is, a system where a patient pays, where the provider pays a monthly fee and you get the care you need. That promotes good health, keeps people engaged with their systems. Fee-for-service means that we only get money when someone is sick and comes in and we treat an illness. That alone will cost our county another $200 million a year on top of $1 billion that I've been talking about. So there's that. Our fifth ask is to please not make mobile crisis response services optional. If they are optional, that means they will not be covered by Medicaid. If they are mandated, it doesn't mean you have to have them, but if it is a mandated service to be covered, they will reimburse us. Of course, our county has been one of the leaders in mobile crisis response and have very good data to show its impact. Number 6, we've asked for the governor to adequately finance in-home support services, which I spoke about a little bit ago. That's designed, as I said, a shared responsibility, federal, state, and county. It pays for personal care and daily living assistance for low-income, elderly, blind, and disabled individuals, a long-term service. I talked about indigent care a minute ago, what happens when people lose their insurance, despite our best efforts, lose their Medicaid or lose their ACA subsidies. At one time, the state funded a program called indigent care. It wasn't like Medicaid. It's very, very basic, life-saving, kind of minimal that you need to do to keep someone alive care. About between 20 and 30% of our population wasn't covered, needed that indigent care coverage. Between the Affordable Care Act and the Medi-Cal expansion, that number dropped to under 5%. So understandably, the state stopped providing money for indigent care. Totally reasonable. But now we are looking at a situation where more people will lose their insurance again, and at the moment, it rests with, guess who? Counties, to fund that care with our general fund, that is with your local property tax dollars. This is not a challenge that counties should or be expected to solve on our own. Let me share, I shared lots of kind of gloom, and I think my opinion of the governor's revised budget should be crystal clear. Fortunately, the state Senate, our 40 state senators, have responded to the governor's proposed budget with some good counter proposals. And this is not official information from the Senate. I don't have any of this in writing yet, but from various conversations, this is what I am gathering is happening. They've proposed $500 million to mitigate HR 1 impacts, including Medi-Cal. That's $500 million statewide. They've also proposed that Walmart, Amazon, and other large companies that push employees onto Medi-Cal pay their fair share based on the number of employees, with that money going to Medi-Cal recapture. I think actually that was in the governor's proposal, and the Senate agrees with it. The Senate is also reportedly going to reject some of the governor's rollback of the Medi-Cal benefits for the UIS population, but not the all-important shift from managed care to fee-for-service. We are hopeful that they will commit somewhere between $100 million and $5 million to protect public hospital infrastructure, and that they will pull back on the proposed changes to IHSS funding. These are worthy efforts. I encourage you to thank Senators Cortese, Wahab, and Becker for their advocacy, and encourage them to hold firm in their negotiations with the governor. The Assembly is likely to publish their proposal next week, so right now is just a dandy time to reach out to your Assembly members to remind them to include money for public hospitals in whatever they put forward. After the Assembly puts their recommendations forward, the governor, the Senate, and the Assembly come together and do a three-way negotiation and somehow come up with a final budget. So these truly are the days and weeks that matter. We do have this small window of time. So today, I am calling on all of you to advocate to Governor Newsom to say no. No to disenfranchising residents with the greatest needs. No to ignoring the catastrophe created by HR 1. No to balancing the budget on the backs of the individuals in our communities who need those most. We are truly blessed to have an extraordinary delegation of representatives from Santa Clara County. I know that they are aligned with our values. Again, please thank your senators and encourage your assembly members to support that $500 million to county's Senate proposal, add a public hospital proposal, and let's just push this as far as we can. It is an incredibly untenable situation. Santa Clara County alone, nearly 465,000 residents, that's about a quarter of our population, close to a quarter, rely on Medicaid for their health care. More than 133,000 residents depend on CalFresh to feed their families. And again, these aren't statistics. These are children and seniors and families. So, in closing, I want to be clear. 2 million Californians losing health insurance is not just a policy decision. It is a threat to hospital stability, local economies, and community well-being. Our communities deserve a clear picture of where Santa Clara County stands and where I stand. My commitment to public safety. Thank you for your attention. Wave a card around if you have a question. All right, David, let's do it. Also, can we thank my team, too? David Fernandez is my Deputy Chief of and Bob Levy helps us. And Bob Levy helps us so much with planning issues that sometimes I feel like he's on my team, but I don't pay him. Sorry, Bob. Okay, let's do it.
Yeah, first question here is, you said that Governor Newsom isn't working with counties. Who, if anyone, is he working with?
Let me first say that this is being live streamed. Kaiser, often the private sector, private developers, healthcare providers, corporations. I don't know what the roots of it are because he was a mayor in the city and county of San Francisco, but really from the time of COVID, he has seemed to feel that counties are not doing what we should be doing, and he has handled us with kind of a foot-stomping, finger-wagging way. That's the best I can do. I don't love it. I have great hopes for the next governor. Been talking to a...
As a resident?
Nope.
Okay. As a resident of San Jose, how is the county preventing homelessness?
So the biggest, the most specific thing that we're doing is that we created a number of years ago a pilot program, which was a type of basic income, guaranteed income program to 2,500 families. It was is now received about $70 million in funding from the TED people, Audacious Project grants, and is being now piloted in cities and counties around the country. It works. The problem is they are pilots because there's no ongoing funding source. So the best way to prevent homelessness is literally to make sure people don't lose their homes. The second best is our rapid rehousing program. It's when we hear and learn that people who are generally already connected with county services in some way are going to lose their housing, and there's no opportunity for a bridge or a loan or an opportunity to keep them in. Our goal is to try to get them back into housing, and we have specific rapid rehousing units set aside that people can live in for 2 years with a very significant subsidy. And at the end of 2 years, because these are folks who were very recently housed, the expectation is that if they stay in their unit, they pay whatever the rate is according to that level of AMI, average median income, or they move out somewhere else. The most expensive piece, but critical themselves, permanent supportive, permanent means permanent. Supportive means social services on site to help them manage. Though that is the end goal for that population. We do invest in shelters. We do invest in transitional housing. The county's model has been to put people into transitional housing when there is a pathway and a unit to permanent housing. What we do not want is for people to get stuck in housing that is supposed to be emergency, interim, or very temporary, but they have no place to go because somebody has decided we can't build permanent housing because it's too expensive and takes too long. It is more expensive, it takes longer, but it is doable. Our county has financed more than 6,000 of those units.
So connecting people to CalFresh and general assistance, it also helps them, prevent falling into homelessness. I find that a lot of the people I talk to aren't accessing those resources.
Excellent point, thank you. And that brings us full circle back to the eligibility workers.
Right.
If we can help people get all of the services for which they are eligible, it is much more likely that they stay housed. Good teamwork.
Awesome.
To community-based organizations to provide those services because by definition, they are based in the community, they are trusted, they are generally culturally responsive and appropriate for the population that they are serving, and often are much better received than the government. So we have very strong and long partnerships in a number of areas, all getting cut. We're not going to disappear anybody, but those are a large portion of the conversations that I have with people telling me, I know you have to make really hard decisions, but you can't cut that. But the minute I start saying, well, this one will get, because that vital work is more vital than another, it really becomes so subjective and so hard to.
Debatement.
Yeah, so the county has 8 expressways. Those are the roads for which we are responsible. I do know that they are on a continuous rotation of repair and maintenance. I do not know how long that rotation is, but that's an answer. So you're asking about also if there's a weed abatement issue, David can also help you get to the right number, place, department, and we will walk you through that.
Great. Dear Supervisor Ellenberg, yesterday I attended a packed action of First Unitarian Church where I heard Supervisors Dwan and Arenas pledge to fund immigration lawyers to help immigrants detained by ICE. ICE treats detainees very poorly, no food, etc. The question is the county going to fund these lawyers to assist immigrants detained by ICE? If so, how much?
Yes, we absolutely are continuing to fund legal services. And when I note that we're cutting, we are not cutting out entirely. We are reducing funding to many organizations. Immigration legal services, we are continuing to fund. I can't remember what the amount was, 6.7 million?
Around that, yeah. And we can get specific information for sure.
Again, we can follow up with the exact number, but it's between $6 and $7 million. You have also seen we did a very big press conference last week highlighting the county created detention center. If you heard the press conference, our county council, lawyers are not, I love you, hon. Lawyers are not generally the rock stars of press conferences, but Tony LaPresta was very clear that we will use every legal tool and strategy we have at our disposal to prevent that from being constructed here, and that we will continue to provide legal services. This is the workforce. These are the folks not only that are doing the work, but are working in the vast majority of our small businesses that are participating in our economy, who have children who have been here. They are the fabric of our community, and we want them here.
Great. Can you please comment on the liability the county faces pending foster care related to the racial justice? Make that the other word, but I think you were talking about this earlier in your first comments.
Say that again.
Yeah.
I heard 2 different things. I'm sorry.
Can you please comment on the liability the county faces based on pending foster care related suits? That's it, suits and the Racial Justice Act?
So those are 2 different things. I definitely cannot comment on any the existence of any ongoing litigation in the county. So I'm sorry, no on that. The Racial Justice Act is an act that was actually created by Ash Kalra, who is an assembly member in an adjacent district, that requires prosecutors to look at convictions that they won to determine whether there was racial bias in reaching those decisions. And that is a very laudable process. It is also extraordinarily time-consuming and expensive. So I'm not sure if liability in that case, that the district attorney's office, whose budget comes largely from the general fund, having to spend more money, as is the public defender, in relitigating some of these cases.
Last one we have here is, can you address fundraising efforts for City Council member Ortiz in his re-election? And then it says, against the budget issues the county is facing.
I don't understand the question. Peter Ortiz is a candidate that I'm supporting. I co-hosted a fundraiser for him. Again, I don't understand what the question is.
Yeah, that's what I got here. So happy if anyone wants to follow up.
Okay. Definitely follow up. Good.
I'll follow up on that. That's my question.
We had agreed and set. Okay.
Hi, Mr. Ellenberg.
Yes.
Susan Bassey.
Yes.
We've been looking at your